Weather emergencies and natural disasters are a predictably unpredictable part of life. Older adults are among the most vulnerable when disaster strikes. That's why it's important for older adults to have a medical plan in place for weather or natural disaster emergencies. CCA Health California works to improve the health and well-being of people with significant needs by innovating, coordinating, and providing the highest quality of individualized care. Here to talk to us about things we can do to prepare to shelter in place or evacuate due to an emergency is Will Yu, General Manager at CCA Health California. Welcome, Will.
Thank you, Desiree. Great to be here.
Yeah, happy to have you on. So today you're here to talk to us about things we can do to prepare to shelter in place or evacuate due to weather or other emergencies. Can you start by telling us why planning for this is so important from a health perspective?
Thank you. Great question. As General Manager of CCA Health California, I live in Northern California, and I, along with many of my fellow Californians over the last few months, have had to endure weather-related crises and emergencies, sometimes evacuating, sometimes sheltering in place. I think today is a great time to create and update your emergency plans. It's important to prepare for both the immediate safety and survival needs, and also recognizing the long-term health needs by minimizing disruptions to care.
Yeah,
The
and
consequences of disruption have lasting consequences.
it's important to have those things set in place before we need them. What are some of the things older adults and or their caregivers, if they have one, can do to prepare for extreme weather emergencies or evacuations?
Great question. There are three main things that one can do to help prepare for these emergencies and minimize disruption. First, it's preparing, really having both the emergency kit that you need for survival, but also a documented care plan, writing down what your care needs are and everything that you need in order to have health and wellness. Second, knowing what is your list of prescriptions. Who would you contact in case of emergencies for care? What are your needs for telehealth and delivery of supplies? Knowing those things is essential to your preparations. And then finally, informing, making sure that your friends and family, maybe even your neighbors, are aware of what your care needs so that they can help support you when the time comes.
Yeah, making sure we have everything buttoned up. And we often think about sheltering in place or evacuations as short-term or temporary, but there can be a lasting impact from these emergencies on health and well-being. Can you tell us a little more about the long-term disruptions to care?
Sure. It's all about really connections to healthcare and having that bridge to the long-term health and wellness, your ability to receive care and self-manage care, both medical essentials and being able to make sure that you have the comfort and well-being, whether it be access to your favorite glasses, access to your warm and fuzzy slippers. These are essentials that you need to help improve your care needs as well as your mental health. So that means having the consistency of survival, also a bridge to your long-term care, and minimizing the disruptions, which can lower trauma and improve your mental health over the long term.
And why might a health plan like CCA Health California be invested in supporting both long and short-term health?
Great question. We want to think beyond health, the immediate health care needs at CCA Health California. We want to make sure that we think about health in terms of months and years, going from beyond survival to a holistic, continual, and consistent view towards healthcare. We've actually created a free guide to help individuals prepare for emergencies, particularly seniors. And that free guide is available at ccahealthca.org. It's really part of our philosophy towards health and wellness.
All right, good to know that there's a free guide for older adults. Will, thank you for joining us this morning.
Thank you. Pleasure to be here.
You bet. And for more information, you can visit ccahealthca.org.